My cousin ended up passing away in June of 2009, 3 months before we were even being considered for the Cancer Center. When we won the award in October of 2009, again, it was a personal family mission to provide something here in Hawaii, something that we deserve for good research paired with good medicine. And then little did I know that 3 months after we were awarded the job, that I would be diagnosed with cancer myself, stage 3 soft tissue spindle cell sarcoma. So we were in the middle of design, and that hit me like a ton of bricks. It became very personal, like no other job could possibly be.
The Cancer Center has just been so marvelous, sharing their facilities, inviting us to participate in different forums that come along, commenting on our experiences both as cancer patients and as it relates therefore to hula in our instance, but also to the cancer in its entirety. In my particular case, hula benefited me health-wise and therefore emotionally in 2 specific areas. As a breast cancer patient, I went through many of the struggles that people in my position do, and the changes were very subtle. After a year or so, it was just so clear to me that my mental acuity was just barging ahead, and I didn't realize it had gotten soft through the experience. The second time around, I had a bad fall, and I was in a brace, as often happens, and I came back to hula sort of piece by piece, and again the body responded, the mental clarity was there, it was absolutely fantastic. Plus the stimulation of enjoying the fabulous music selections and the choreography of this particular kumuhula. Te Moana Makolo is just fantastic, especially with traditional dances, which those of us who are born and raised here especially like and love. So thank you and mahalo.
At the end of the hula study program, I found with some of the ladies that it really helped them in many ways. A couple of the ladies told me that they were even suicidal, which I was stunned, but hula helped them to come out of that. and they became happy with their life and just with things in general. In August of 2017, I found that I had stage 4 bone cancer and really bad arthritis on top of that. But hula again helps me physically as well, even though I can't really stand up and hula like I used to, and I can't really walk on my own like I used to. I can still teach the ladies, and it's fun. I enjoy seeing them and coming to hula and knowing that I'm doing something constructive and I'm doing something to help them with their health issues as well.
I did a stem cell transplant here at Queens Hospital. We did it on April 21st, 1999. I was very fortunate I did it here because with all blood cancers, your treatment is done in the mainland. Back then, I had a son who was totally dependent on care. So, when I got diagnosed, I just didn't know what was going to happen, who was going to take care of him. But when Dr. Sumida offered me this clinical trial, and I said, sure. So I'm glad I met the criteria for that.
I joined the Friends of the University of Hawaii Cancer Center board to be able to continue to support and carry on the legacy that I believe my sister Alana started many years ago when she passed away from leukemia. Unfortunately, when she needed treatment, the University of Hawaii Cancer Center didn't exist, so we had to travel to the mainland for her treatment and her care. It's a privilege for the Friends to continue to support the amazing work that goes on here, whether it's the researchers, the fellowships, the grants, all the way through to the early phase clinical research center that's being built and developed. We're very excited to see how that impacts the people of Hawaii and be able to continue to support our local communities here at home.
I believe I am an original member of the first cohort of island residents that completed the 26-page questionnaire about dietary habits, lifestyle, and medical history. Over the years, I have continued to fill out follow-up questionnaires from MEC, donate money and urine samples, participated in smaller studies focusing on memory skills, and I've even done brain scans. I will do this until the day I pass, as long as MEC exists, because I believe in this study. Recently, I spent some time reading some of the conclusions drawn from this work, and I am more convinced than ever that every second of my time dedicated to this task will result in knowledge that will save lives and speed up the understanding and focus in finding the best approaches for battling each cancer and ultimately a cure.
On the swing, it doesn't mean a thing. What do you do? Keep your eyes on the house, and when she goes around the aisle, swinging hips and tantalizing, keep your eye where they belong. And when her breath goes to swishing in your head, and don't go wishing that you would like to mow the lawn. You're leading but fooling no one. These concealing we're having some trouble.
What do you do?
Keep your eyes on the head. You're watching a hula girl dance. Better be careful, you never go bad. Keep your eyes on the hips, the naughty hula hips. Keep your eyes on the head. Remember she's telling a story to you. Her rope is swaying, but don't watch the view. Concentrate on the swing, it doesn't mean a thing.
What do you do?
Your eyes on the head, and when she goes around the aisle and swinging hips and tantalizing, keep your eye where they belong. And when her breath goes swishing, keep your head and don't go wishing that you would like to mow the lawn. Your eyes are fooling but fooling no one. Ways concealing we're having some fun. But if you're too young to date or over 98,
What do you do?
keep your eyes on the head. Don't keep your eyes on the head.
Aloha, friends of the UH Cancer Center. I'm Josh Green, your Lieutenant Governor and a physician that practices on the Big Island. I wanted to say thank you. Thank you to all the supporters over the years that helped build this UH Cancer Center. Phenomenal people, every one of you. I want to also single out a couple specific names. Lawrence Piet, who was one of our early directors back in the 70s and 80s. Brian Issel, a doctor from 88 to 99, contributing in big ways to cancer research in our state. Carl Wilhelm Vogel, Dr. Vogel, who also worked from 99 to 2008, was very central to keeping cancer research going in our state. There is someone special I'm going to save for last, but I'd also like to mention Director Jairus Hedges. Dr. Hedges is a good friend and ally who has been important as an interim director and head of the med school, and then Randall Holcomb, another doc who I have a great deal of respect for. But I wanted to say something special about a dear friend of mine, Michele Carbone, Dr. Carbone. We would have never built this cancer center without Dr. Carbone's passion. He brought this cancer together under budget, faster than we ever imagined, using the resources that the legislature gave through the tobacco tax. Michele has been our hero, at least in my household. He's been our champion to make sure the Cancer Center is magnificent, that it came to a time in Hawaii when we had a lot of concern about not being able to give good cancer care to our people. So tens of thousands of people have benefited from him building this cancer center. Again, thank you to all of you who contributed over the years. There is no question that many of our philanthropists who are in the audience today, who have brought millions of dollars, lots of compassion to this project, are also worthy of being singled out. And I know they will be singled out by many of us today for their philanthropy. But Michele Carbone, he's my champion and my hero on this cancer center. Aloha, and thank you all for what you do for the people of Hawaii.
Hello, I'm Ned Sharpless. As director of the National Cancer Institute and a former Cancer Center director myself, it is my great pleasure to congratulate the University of Hawaii Cancer Center on 50 years of cancer care and cancer research. As we commemorate UHCC on its 50th anniversary, we're also celebrating 50 years of the National Cancer Act of 1971 here at the NCI. That single piece of legislation cemented our nation's commitment to basic research. It enabled the NCI, which is part of the National Institutes of Health and is the federal government's principal cancer research agency, it enabled the NCI to pave the way for life-saving breakthroughs in cancer research. Among the Act's many accomplishments, it established the NCI's Cancer Centers programs. And today, that program includes UHCC, as well as 70 other designated centers across the nation that deliver cutting-edge cancer treatments to patients and communities throughout the United States, and also has the mission of really advancing cancer research for our patients. Each year, 250,000 patients receive their diagnosis of cancer at an NCI-designated cancer center. These centers treat an even larger number of individuals and enroll thousands of patients in clinical trials each year. Since 1991, the annual mortality of cancer has steadily declined. And this is really a testament to the work of the NCI, as well as our cancer centers and other stakeholders, that has led to this real golden age of cancer progress in terms of better diagnosis, treatment, detection, and prevention of cancer. And based on this progress, President Biden has now called on us to end cancer as we know it. And I do think that's possible thanks to this golden age of cancer research. Yet while tremendous progress has been achieved throughout the last few decades, cancer still kills 600,000 Americans a year. There's still much work ahead of us to end cancer's tragedy. To achieve that, we must ensure that cancer research and its breakthroughs reach all patients with cancer. UHCC's mission emphasizes the unique ethnic, cultural, and environmental characteristics of Hawaii and the Pacific. Each of us must emphasize our responsibility to understand the communities we serve, to overcome the persistent disparities that can perpetuate cancer's burden, and even more so in underserved populations. So congratulations to UHCC on its 50th anniversary. I wish you the best in achieving the success that will help us all end cancer as we know it.
I am honored for the opportunity to address this gathering to celebrate the 50th anniversary of the Cancer Center of Hawaii and the 25th anniversary of continuous National Cancer Institute designation. We are at this milestone with the Cancer Center in the strongest position it has ever been in, thanks to the leadership of Director Randy Holcomb and the amazing efforts of the Cancer Center's highly productive researchers and staff. I am pleased to have been a participant since its inception in the multi-ethnic cohort study that the Cancer Center and the University of Southern California began more than a quarter of a century ago. And I am particularly pleased that I am able to continue to provide data for this study. I offer my congratulations to the entire staff of the Cancer Center as it embarks on its second half century, providing key research into the causes and cures for cancer for the benefit of the people of Hawaii, our Pacific Island neighbors, the nation, and the world. Carry on.
Good morning. I'm here today to celebrate the 50th anniversary of the University of Hawaii Cancer Center. My husband, Dr. Lawrence H. Piet, was the first director of the first small cancer center here in Hawaii. Surely, with COVID-19 upon us, we can understand the importance of Dr. Richard K.C. Lee's first NCI grant in 1971. It is exciting to recall and remember Dr. Frederick Greenwood and Larry, both involved in cancer studies, soon were aware of the number of research activities at the University of Hawaii and in the community. They recognized a need for coordination and collaboration. The center they proposed should act as a focal point. Then the Board of Regents approved the establishment of the Cancer Research Laboratory on the university campus. There followed then President Harlan Cleveland's proposal and establishment of an advisory council made up of leaders in cancer studies and leaders in the community, which included Maurice Sullivan. He insisted or stressed the need for total community involvement. It's also exciting to read or remember Governor Burns' inaugural address, in which he suggested that Hawaii should expand from its agricultural and tourist economy to become also a center of international research, especially in the Pacific. Nationally, President Nixon declared a war on cancer, and funds were created. There followed many trips to Washington, D.C. Grants and funds were sought and won. Senator Daniel Inouye led a strong fight, and I quote, he said, "I can assure you that the people of Hawaii need an aggressive and visible cancer center." Multiple trips to Washington, D.C., often in the winter, which incidentally meant the purchase of a good winter coat. That was expensive. Let's celebrate these 50 years. This little island in the Pacific is not so little. The UH Cancer will continue to discover, to educate, and to contribute. Hooray for us.
The future is bright at the University of Hawaii Cancer Center. Our laboratory staff work day and night running experiments that focus on improving our basic science understanding of how cancer develops and progresses, identifying new targets for therapies, and translating these findings into treatments of tomorrow.
We are the University of Hawaii Cancer Center.
Our clinical research assistants work alongside local oncologists to help Hawaii's cancer patients fully understand and enroll in clinical trials, helping develop the next generation of safe and effective cancer treatments.
I am the University of Hawaii Cancer Center.
Our population science staff conduct interviews and surveys of Hawaii's people to probe how ethnicity and factors such as cigarette smoking, electronic cigarette use, sun exposure, diet, and exercise intersect with cancer prevention and cancer outcomes.
We are the University of Hawaii Cancer Center.
And we're training the next generation of cancer researchers through the CREATE program, which includes seminars, workshops, career development sessions, and of course, hands-on research experience.
We are the University of Hawaii Cancer Center.
We've been working for 50 years to reduce the burden of cancer through research, education, patient care, and community outreach, with an emphasis on the unique ethnic, cultural, and environmental characteristics of Hawaii and the Pacific. And we're just getting started.
We are the University of Hawaii Cancer Center.
I, Ho'makaukou.
I.
Hula. To you.
Sweetheart, aloha, from the bottom of my heart. Keep that smile on your lips, brush the tears from your eyes. One more aloha, then it's time for goodbye to you, sweetheart. Aloha, we dream I'll be with you, dear, tonight. And I'm grateful that day when we all will meet again. Until then, sweetheart, aloha. To you, sweetheart, in dreams, I'll be with you, dear, tonight. And I'm grateful that day when we all will meet again. Until then, sweetheart, until then,
Aloha.
Today is July 23rd, 2021, and Kahu Aaron Mahi is here at the UH Cancer Center to conduct a blessing of the site of the future Early Phase Clinical Research Center, which will provide access to Phase 1 clinical trials for cancer patients in Hawaii. It will be the first of its kind in the state and will bring cutting-edge clinical trials closer to home so patients don't have to face the physical, mental, and financial burdens of traveling to the continental U.S. for specialized treatments. Today, the day of a full moon, is a favorable day to conduct the blessing of the Early Phase Clinical Research Center based on the moon calendar. Mahina, the moon, plays a significant role in the Hawaiian culture, as their lives were guided by the phases of the moon. The Hawaiians created a moon calendar with different phases that contributed to their understanding of and ability to live in harmony with the natural world around them. As the moon waxes, they believe certain activities would flourish. As it wanes, it's time to rest. The first floor will be the lobby and reception area where we will welcome people into the facility. There will be examination and consultation rooms to see new patients and a small lab to process blood work. On the second floor, there will be another receiving area where patients can check in for treatment. This floor will mainly consist of infusion suites where clinical trial participants will receive state-of-the-art treatment. In addition, there will be a pharmacy, nurse station, education room, nutrition area, and meditation area. The designers of the facility, with input from the UH Cancer Center's Native Hawaiian Advisory Board and leadership, are incorporating elements representative of the Hawaiian culture throughout the building. Every patient of this facility will participate in cutting-edge clinical research study. Hawaii's unique racial and ethnic diversity in these studies impact cancer patients and research all over the world. The third floor will be used as lab and office space and will house an organoid facility. Researchers will construct 3D cell culture systems that mimic the characteristics of real organs, allowing them to better understand organ-level biology than our current resources allow. The center will not only affect cancer patients, but will create jobs for the people of Hawaii and help to diversify the state's economy. The development of a program in early phase cancer clinical trials, along with the recruitment of the faculty physicians, nurses, and pharmacists, is a joint venture of the UH Cancer Center, the University of Hawaii, and clinical partners in the Hawaii Cancer Consortium. Thanks to the support from the community and state legislature, particularly the late Senator Breen Harimoto, we have received the funds necessary to begin development. Construction of the early phase clinical research center will be completed by fall 2023.